name is Brianna Stanley. This is Erin Rayford. We're here to present to you our community health project and our community health risk assessment for Appling County and more specifically Graham, Georgia. As you know, Appling County is a very small community and doesn't have as many resources to help health promotion as many of the larger communities within Metro Atlanta. Appling County has a very high mortality rate for heart disease. It's currently at about 491 per 100,000 people. This is actually one of the highest rates in the state of Georgia and even in the United States. An obvious contributing factor to heart disease is obesity, and Appling County is also one of the highest obesity morbidity rates, coming in at about 30.2%, whereas the state of Georgia is averaging at about 23%. So again, the obesity rate is very high for Georgia and the United States.
So to best begin a health promotion project, it's going to be ideal to begin at a community level. We have chosen Graham County, which is obviously the smallest county in Appling County, with a population of only 291 according to the 2010 census. Obesity education and management, specifically to nutrition and physical activity, should be implemented at the various levels of healthcare prevention in order to be most effective.
So at the different levels, we have primary, secondary, and tertiary prevention. On the primary prevention level, our main target is going to be the younger youth population within Graham, Georgia. The plan is to institute healthier food choices and smaller food portions at the school age level. So we can do this by providing written documentation to the federal government of our community's needs. And they will in turn provide us with an ECE, which is an early care and education license. This will allow the child and adult care food program to federally mandate the funding for regulated meal patterns, portion sizes, nutrition education, sample menus, training and meal planning, and all of which would comply with nutritional standards and help decrease the obesity rate within Graham, Georgia.
So at a secondary level, the plan is to implement community cooking classes to ensure healthier food preparation. The goal is to promote a diet that will ensure caloric balance, meaning caloric intake is going to not exceed the energy expenditure. We can actually bridge off the information given by the child and adult care food program already established in the school system for meal planning, and this is going to decrease our financial cost. Physical activity should also be increased within the community. A long-term goal would be to increase the number of actual recreational facilities, but currently, as just a suitable short-term goal, would be to get individuals involved in the community with things that are already in place, such as the local YMCA and intramural sports. And we just want to promote a safe and entertaining environment that will entice all of our local community members to attend these activities.
And lastly, on the tertiary level, for those adults who are already at an unhealthy weight and are already experiencing health complications related to obesity, telehealth is a great aspect that would help the Graham community. Telehealth provides community members with adequate access to healthcare at their convenience. Appling County already has a telehealth program developing in the Appling County Hospital system. They have been awarded a 3-year, $160,000 per year grant that includes technical equipment and supplies. So if we can help develop this program by giving additional financial support as needed and have access to this healthcare delivery system, the telehealth in Graham, Georgia, and allow expansion to our smaller cities and communities, this in turn would reduce or prevent health-related issues to obesity and prevent obesity from escalating to those cardiovascular events that are increasing the mortality rate that we're seeing in Appling and in Graham, Georgia.
Exactly. And so overall, the program's impact will directly affect these specific comorbidities and risk factors associated with heart disease. In turn, this program is going to be intended to promote an overall decrease in Appling's high heart disease mortality rate. So we're just asking, let us help you. By supplying us a small amount of funding, we can increase the overall health status of this county and the livelihood of the individual communities. Thank you.